Welcome to the Institute of Skin Science. Today we are going to be talking about tyrosinase inhibitors, specifically what they are and why they are so beneficial. Before we dive into tyrosinase inhibitors though, let's first understand what tyrosinase is. Tyrosinase is a copper enzyme that begins the production of melanin from tyrosin by oxidation. So essentially, tyrosinase is what starts the chemical reaction to create melanin. This is what gives the skin its pigment or color. Now, this copper enzyme is located in the basal layer of the epidermis, which is the lowest level. Now, tyrosinase actually works with your melanocyte, which is this cell here. It's a dendritic cell, which means it has branch-like legs. And your melanocyte is where melanin is created and then transported to give your skin its color. Now, if you look closely inside this melanocyte, you can see these little spheres. These are called melanosomes. Melanosomes are actual carriers. So inside of these little spheres is melanin, or the pigment. So this melanocyte is going to create the melanosomes, which are then going to carry melanin throughout the layers of the epidermis, resulting in the color of your skin. Now let's talk about melanocytes for just a few minutes. Your melanocyte is an immune cell, and it's responsible for creating the pigment that gives you the color of your skin. Now what's interesting to know is that we all have about the same number of melanocytes, whether you have very fair skin or you have a deeper complexion. The only difference is if you have a deeper complexion, your melanocyte is actually producing more melanin to give you that richer complexion. It's often misunderstood that someone with a deeper complexion has more melanocytes, and that's not the case. Their melanocytes are just producing more melanin. In fact, about 50% of the total melanocytes in the body are located in the face and décolleté. That is why the face and décolleté are so prone to pigmentation disorders, because the majority of our melanocytes are located in those areas. If you look to the right here, you can see those melanosomes, or the spheres that are carrying those granules of melanin, and this is kind of what the process looks like. Your melanocyte creates melanosomes, which then carry pigment throughout the layers of the skin, resulting in your complexion. If this process is healthy and hasn't been interrupted in any way, then you should have even-toned skin that's very beautiful and even. However, there are extrinsic and intrinsic factors that actually can hinder this process, resulting in hyperpigmentation. There's a number of things that can lead to hyperpigmentation. Things like medication, hormone imbalances, trauma to the skin, and the one that we as estheticians most commonly see are UV rays. Now, if you look to the left, you can see normal skin that has a melanocyte that's producing the right amount of melanin to give the complexion of the skin. Okay, melanin actually helps to protect the body from UV damage. If you look to the right, you can see skin that's been exposed to UV rays. When you go out into the sun unprotected without wearing SPF or having a hat or some type of coverage, UV rays penetrate the skin, and your body's immune reaction to heal and protect itself is actually to boost the melanocytes to make more melanin, which will then result in more pigment in the skin. This is also called a tan. Although tans look very beautiful and give a nice glow to the skin, they are very bad. It's your body's way of telling you that it's not being protected and is resulting in an increase of melanin to try and protect itself from those UV rays. This can be very damaging, and over a period of time, it can actually produce trauma that's chronic. The three most common hyperpigmentation disorders that we as estheticians see and care for in our business is the first being post-inflammatory hyperpigmentation. We also refer to this as PIH. If you look at the picture on the bottom to the left, this is an image of post-inflammatory hyperpigmentation. This is pigmentation that is created anytime that inflammation is present. We most commonly see this after an acne lesion. The characteristics to this pigmentation disorder is going to be more of a purple-red undertone, and is considered to be very superficial to superficial pigmentation. The next one we see is photo damage or dark spots. This picture here in the middle is a great representation of what that looks like. It is going to be a section on the skin that has been damaged and is now misfiring pigment, resulting in a dark spot. Last but not least is melasma. Over here to the right, you can see melasma. The characteristics for melasma is going to be much more of a mask-like of pigmentation on the skin. Now, it's important to know that just because someone has melasma, it doesn't mean that they were pregnant or were pregnant at one point. Melasma can be triggered by many things like medication, birth control, and hormone imbalances. So melasma isn't always associated with a pregnancy. Now let's talk about tyrosinase inhibitors. Well, given the name, we can see here that these are ingredients that are going to inhibit the enzyme tyrosinase from over-oxidizing or misfiring that production to make melanin or pigment. So if we look at this melanocyte over here, when a melanocyte has been damaged, it will always be damaged. So anytime you're working with a hyperpigmentation disorder, in order to actively care for and restore that melanocyte, you will always have to use a tyrosinase inhibitor. Now, tyrosinase inhibitors help to prevent the misfire of tyrosin, which is then going to produce that pigmentation in the melanocyte. Certain tyrosinase inhibitors also help to hinder the melanosomes or the production of melanosomes, resulting in lightening of pigmentation. And I'm going to talk about that a little bit more a little bit later. Essentially, tyrosinase inhibitors are needed in order to help reverse or to lighten pigmentation that has been created in the skin. Now, there are two types of tyrosinase inhibitors. The first type is natural lightening agents. Now, these lightening agents are derived from foods, plants, and are sometimes bioavailable forms to help inhibit tyrosinase from making too much melanin. So they don't work with the melanocyte directly. They actually work with that copper enzyme to prevent that misfire of pigment, helping then to reduce the pigment that's being made in the melanocyte. Some examples of these lighteners are bearberry root, licorice root, ascorbic acid, also known as vitamin C, 1-methylhydroxytoluamide, mulberry, and arbutin. Now, these are just a few. There are a lot of natural lightening agents out there. The second one is prescription lightening agents. Now, these are bioavailable ingredients that are made and contain the active ability to prevent the overproduction of melanin from the melanocyte. So these ones are going to be working directly with the melanocyte to prevent the melanosomes from releasing too much pigment into the skin. The most common and only FDA-approved ingredient is called hydroquinone. So your more natural lightening agents are going to be working more with the tyrosinase enzyme, so that copper enzyme. And they're going to help inhibit that tyrosinase enzyme, that copper enzyme, from producing too much tyrosin, which is then going to signal the melanocyte to produce pigment. So you're working more with the tyrosinase enzyme than you are the melanocyte. Now, with prescription lightening agents like hydroquinone, you're actually working inside the melanocyte to prevent or inhibit the overstimulation of melanosomes, and so you're helping to prevent pigment from actually getting into the skin. Now, this process, using hydroquinone, you see much faster because you're working directly with cells that are being created in the epidermis. Whereas natural lightening agents, you can get a really nice even tone, but they're going to take a little bit longer because they're working with the actual enzyme and not the melanocyte. So it's going to take time for you to see a difference from that tyrosinase rather than with hydroquinone that's working with the actual cells that is already being produced, that pigment's already being produced in the epidermis. So let's talk about that a little bit more. So when can you see results and how quickly can you see results? Natural lightening agents are wonderful. They're a really great alternative to anyone that doesn't want to use a more synthetic or chemically made ingredient. And you can get really nice evening results with them, but they do take longer because they are working with that tyrosinase enzyme and not directly with the melanocyte. So clients can start to see a difference in the skin as little as 30 days, with 60 to 90 days being the real area where they start to see changes in the skin and that lightening of hyperpigmentation. Now, prescription lightening agents, they work much faster because they're working directly with the melanocyte, so that hyperpigmentation is being repressed faster. So you start to see that lightening and brightening happening much quicker. Clients can start to see a difference in as little as 2 weeks, with 30 days being the most drastic results. However, it's important to note that hyperpigmentation is like an iceberg, and so sometimes you're treating that superficial pigment that's on the surface when underneath the skin. So if you look at this epidermis here, so sometimes you see pigment that's already been brought to the surface and you are starting to care for that. But pigmentation is like an iceberg, and sometimes underneath the surface of the skin, there's a lot more pigmentation that hasn't come up yet. And so it's important to know that if you're working with a more moderate to advanced pigmentation disorder, that it is going to take a little bit longer to see those results for lightening and brightening the skin. It's also important to note that we are working inside the skin, and so you will start to see lightening and brightening on the surface, but it does take time because we have to affect all these cells that are located in the epidermis. Once these cells are actually adjusted from the misfire of pigmentation, so once that hyperpigmentation has been corrected, these healthy cells need time until they get to the surface for you actually to see the difference in that lightening and brightening of the skin, because it's going to take time, about 28 to 48 days, for you to see these healthy cells without that overproduction of melanin come to the surface. So it's not always a very fast result. Now let's talk about who should be using a tyrosinase inhibitor and why they should be using it. Well, essentially everyone should be using a tyrosinase inhibitor, and I'm going to cover this more in the next few slides. But especially anyone who has pigmentation disorders in their family. So if someone's mother struggled with melasma or their grandmother struggled with melasma, there's a good chance that they are prone to that pigmentation disorder as well. And then especially our skin of color. Like we talked about earlier, someone with a deeper complexion means that their melanocyte is creating more melanin. So they have a greater risk of having hyperpigmentation disorders than someone that is more fair. And we'll talk about that in just a second. So when we're looking at Fitzpatrick's or skin tones, we have two groups. We have melanocompetent and melanocompromised. Melanocompetent is going to be your Fitzpatrick's 4 through 6, and then your melanocompromised are going to be your Fitzpatrick's 1 through 3. Melanocompetents actually need to be on a stronger tyrosinase inhibitor in order to protect their cells. Their melanocyte, if you look here to the left, this is a deeper complexion, their melanocyte is producing more melanin than someone that is fairer. So since their body is already stimulating and producing more melanin, they are at a greater risk of developing hyperpigmentation disorders. Okay, what is also interesting to know is that someone with a deeper complexion are actually more protected from UV rays because they have more of that melanin to protect from that UV ray damage. And they are less likely to develop skin cancer. It doesn't mean that they're completely immune, but they are definitely less likely. Melanocompromised are going to be your fairer complexions. These are your Fitz 1 through 3. They have a less chance of hyperpigmentation, but a greater risk of developing skin cancer. And the reason for that is because the melanocyte doesn't produce a lot of melanin, so they don't have a lot of pigment to protect themselves from UV rays. However, it's important to remember in your consultation with your client, you need to know their background and their history. Just because you have someone that's very fair doesn't mean that they don't have a deeper ethnicity in their background. For instance, I had a client once that was very fair. She had the most beautiful fits 2 complexion, so very fair. But when I looked into her consultation form, I saw that her father was actually Spanish, and so she carried traits of a deeper Fitzpatrick. In that situation, I'm going to treat her like a deeper Fitzpatrick because she can be prone to pigmentation disorders, and it's important that you protect the skin throughout all treatments and treat them like a deeper Fitzpatrick, or you can lead to hyperpigmentation disorders. So if we are going to go ahead and look deep into the epidermis here, you can see on the left, this is a deeper complexion. Their melanocyte is definitely more active. It's releasing more pigment, resulting in that richer complexion. And then over here to the right, we have the melanocyte in a lighter complexion. It's not producing as much melanin, so they don't have a deeper complexion or more pigment to their skin. But it also means that they're more vulnerable to skin cancer. Now, almost everyone is born with healthy skin, and as we age and develop, that is where skin conditions and disorders begin to occur. Everyone should be on a tyrosinase inhibitor. Even if you have healthy skin, you want to make sure that you are protecting the skin and preventing that pigmentation disorders from forming. Remember, once a melanocyte is damaged, it will always be damaged. So even though someone has bright, even-toned skin, it doesn't mean their skin's going to stay that way. And we want to get them on a tyrosinase inhibitor to help maintain that healthy, beautiful complexion. Our deeper Fitzpatricks absolutely need to be on stronger tyrosinase inhibitors because we need to make sure that we are controlling the melanin that is being produced, and so that they don't develop more pigmentation disorders from any type of damage to the skin, whether it's hormone related or if it's trauma related. So let's talk about a few of GlyMed Plus's tyrosinase inhibitors. I absolutely encourage that every single client that you have, including yourself, should be on a tyrosinase inhibitor of some strength. I'm going to talk about our tyrosinase inhibitors from least aggressive to more aggressive. The first tyrosinase inhibitor that I'm going to talk about is living cell clarifier. Now, living cell clarifier is a really great introduction to tyrosinase inhibitors because this is going to actually start protecting the cells and preventing future damage from happening. Living cell is great for prevention and maintenance. It is not a serum that I'm going to recommend to someone that already has pigmentation disorders present. So if someone has melasma, dark spots, or photo damaged, I'm not going to choose living cell clarifier because it's more of a preventative serum. Now, this serum contains natural tyrosinase inhibitors or natural lighteners and brighteners. Those include bearberry extract, licorice extract, and mulberry. These are all going to help protect the tyrosinase enzyme from overproducing tyrosin to create that melanin. This is also jam-packed with lots of antioxidants that help to correct free radical damage in the skin, so helping to reduce inflammation and future trauma. I recommend this serum for anyone that has post-inflammatory hyperpigmentation because, again, PIH is more superficial to very superficial, and so living cell can actively help to brighten that complexion sooner, helping to relieve that purplish reddish tone. It's also recommended for even skin tone to maintain those results and very superficial pigmentation. Living cell clarifier can be used twice a day and is safe for all Fitzpatrick types. Now, tyrosinase inhibitors are helping to inhibit the overproduction of melanin. When this happens, it's skin vulnerable, and so when using tyrosinase inhibitors, you have to be using a really high quality SPF or sun protection factor. Okay, since we are a little bit more vulnerable because we're working with that melanocyte and the pigment that's being created in the skin, we need to make sure that we're protecting and caring for the skin at the same time with a high quality SPF. Next, we have the Dermapigment Skin Brightener. Now this lightener is really great for more mild to moderate hyperpigmentation, and you can actually start to see a difference with that lightening and brightening in just 30 days. Now our Dermapigment Skin Brightener has 5% glycolic, which is actually working more as a delivery system to take that natural tyrosinase inhibitor deeper into the skin. The main lightener in the Dermapigment Skin Brightener is our 1-methylhydroxyamide. Again, this is a natural tyrosinase inhibitor, so it's going to help to lighten and brighten the skin. I recommend this brightener for more mild to moderate hyperpigmentation and photo-damaged skin. And this is the lowest tyrosinase inhibitor that I would start my deeper Fitzpatrick's on. So if you have a client with a deeper complexion, this is the lowest skin lightener that I would put them on. They either need to be on this or something that's stronger. And again, the reason for that is because their melanocyte produces more melanin, so they are at greater risk at developing hyperpigmentation. So we need to protect their cells. This serum can be used twice a day and is safe for all Fitzpatrick types. Again, your client needs to be using a high quality SPF when using a lightener. Next, we have the Dermapigment Bleaching Fluid. Now, the bleaching fluid, despite the name, does not bleach the skin. This is going to be one of our strongest tyrosinase inhibitors that is going to be the most active for helping to remify hyperpigmentation in the skin. This is for more moderate to advanced hyperpigmentation, and the results can be seen within 2 weeks. It does contain 2% hydroquinone, which is the only ingredient that is recognized by the FDA to actually lighten and brighten the skin. That doesn't mean that other ingredients don't work, but this is the only one that's recognized by the FDA. Hydroquinone, like we said earlier, is going to help prevent the melanocyte from releasing excess or overproducing melanosomes that are going to carry that pigment to the skin. So it doesn't bleach the skin, but it definitely lightens and brightens pigmentation. It also has aloe vera, which helps to inhibit infection, provide hydration, and actually contains 18 out of the 20 amino acids that your skin requires to be healthy. I recommend the Dermapigment Bleaching Fluid for more moderate to advanced hyperpigmentation, such as melasma, dark spots, and photo damage. And it's important to know that you can only use this product at night. You cannot use the bleaching fluid during the day. And of course, a high quality SPF must be used with this product. I recommend going on the bleaching fluid for 1 bottle and then alternating my clients to the next tyrosinase inhibitor that I'm going to talk about in just a minute. And so that we're not over restricting that melanocyte from producing pigment. So I like to alternate my bottles. The last but not least tyrosinase inhibitor is our Diamond Bright Skin Lightener. Now this lightener is going to be just as effective as our bleaching fluid, however, it does not contain hydroquinone. This is a perfect alternative to a client that does not want to use hydroquinone in their home care. And I encourage everyone to do your own research on hydroquinone. I personally think it's a fantastic ingredient, but there are clients out there who do not want to use it in their regimen, and that's totally fine. We have a solution for them as well. The Diamond Bright Skin Lightener is great for more moderate to advanced conditions or concerns, and it actually contains our advanced drone technology. Now, if you're not familiar with our advanced drone technology, we do have a webinar that goes more in depth, but this is actually a delivery system that takes targeted ingredients to a specific area or cell in the epidermis and helps to directly treat an area that has damage. The drone technology in our Diamond Bright is actually working with injured melanocytes to help prevent the overproduction of melanin in the skin. So you get just as good of lightening and brightening as hydroquinone, but without hydroquinone. What also makes this one so unique and special is that it's actually safe to use while pregnant and nursing. I recommend this for more moderate to advanced hyperpigmentation, such as melasma, dark spots, and photo damage. This product can be used morning and night, so twice daily, and is safe for all Fitzpatrick types. Again, if I have a client with more moderate to advanced concerns, I usually will start them on either the Diamond Bright Skin Lightener or bleaching fluid. If they're on the bleaching fluid, I have them alternate between bleaching fluid and Diamond Bright. So if they finish their bleaching fluid, the next product I'm going to have them get is the Diamond Bright. And then I would just alternate back and forth, back and forth. Once your client actually gets the even tone that they desire, they don't have to stay on a stronger tyrosinase inhibitor if they don't want to. They can actually go down to our living cell to help maintain that even tone. But just know that if a client has hyperpigmentation, that their skin has a memory and they will always be prone to that pigmentation coming back if they are not protecting and caring for their skin in the meantime. That concludes our tyrosinase inhibitor webinar today. If you have any questions, please reach out to your master esthetician here at GlyMed Plus, and we look forward to seeing you next time.